Welcome, everyone. Thank you for joining us today. I'm Theresa, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Overall, 15,083 individuals have been tested for COVID-19. Currently, we have 777 tests that are pending. Please check the Ministry of Health's online portal or the link on our website to access your results online. I will now share the most current case counts. There are 84,688 confirmed cases of COVID-19 in Canada and 25,500 cases in Ontario. Chatham-Kent has 143 cases and Sarnia-Lambton has reported 248 cases. Michigan now has 54,679 cases, with 10,699 cases being in Detroit. Today, we are reporting 912 cases of COVID-19 in our community, an increase of 36 cases from yesterday. 33 of the 36 new cases are people working in the agri-farm sector. 479 cases are resolved, and 16 people are in hospital. 18% of our cases are between the ages of 20 and 29 years, 17% are between the ages of 30 and 39 years, and 17% of our cases are 80 years or older. 47% of cases are male and 52% are female, with 1% unknown. Our community has lost a total of 63 people to COVID. 47 deaths have occurred among residents in long-term care and retirement homes. 4 long-term care and retirement homes are currently experiencing a COVID-19 outbreak. Based on a new directive from the Ministry of Health, effective immediately, testing is available for the following populations. Symptomatic testing, all people with at least one symptom of COVID-19, even a mild symptom. And asymptomatic risk-based testing, people who are concerned that they have been exposed to COVID-19. This includes people who are contacts of or may have been exposed to a confirmed or suspected case of COVID-19, and people who are at risk of exposure to COVID-19 through their employment, including essential workers such as healthcare workers, grocery store employees, and people working in food processing plants. No one who is symptomatic or who is concerned that they have been exposed to COVID-19 will be declined a test at an assessment center. Common symptoms of COVID-19 include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Alet Campus. Please note that SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wichu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. Thank you for joining us again. I hope everyone enjoyed a nice weekend. To start off with some good news, over the past week, we have gone from working with 18 long-term care and retirement homes that were in COVID-19 outbreak down to 4. It is of great relief to see our homes move in a positive direction for our community, the residents, and their families. From Friday, we are reporting an additional 69 cases of COVID-19, and for today, 36 new cases. Of the 36 cases we are reporting today, 3 were from community, and 33 are from local farms. As you know, this area is home to a large agriculture sector and many large farm employers. The Windsor-Essex County Health Unit has been working actively over the past few months with all the farms as essential services to test their workers. provide direction on self-isolation and other health and safety measures. It is important to note that these cases are not from one facility, but many, and include community employees and temporary foreign workers. I would like to remind our employers and employees in the community to follow public health guidance. As workers come together, just like gathering in the community, this increases the risk of transmission for COVID-19. Employers and employees must ensure physical distancing at all times, wash their hands regularly and often, and stay home if they're sick. If physical distancing cannot be maintained in the workplace, employers should consider policies that require the use of masks to protect employees from each other. When going out, whether to work, to park, or to a grocery stores, please remember to maintain physical distancing at all times. Wash your hands, cover your cough, and avoid touching your eyes, nose, and mouth. If you cannot maintain physical distancing when you're out, wear a cloth mask covering. Given the temperature rise over the weekend and expected forecast throughout the week, it is even more important that we exercise due diligence and practice physical distancing. Cloth face coverings do not take the place of hand washing and physical distancing, and may be difficult for the residents to wear for a longer period, especially in warmer weathers. When the forecasted temperatures are expected to be at least 31 degrees Celsius, or the humidex is at minimum of 40 degrees Celsius for 2 days, the Windsor-Essex County Health Unit will issue a heat warning. Individuals at highest risk for heat-related illness include older adults, infants, and young children. Individuals with chronic conditions, individuals who work outdoors, or spend extended period of time outside. Some of the signs of heat illness include headache, dizziness or fainting, nausea or vomiting, rapid breathing, dehydration. To protect yourself from heat-related illness, drink plenty of water to stay hydrated, wear a wide-brimmed hat and lightweight clothing, take a cool bath or shower, limit outdoor activities to cooler parts of the city, and seek out shade. Wear sunglasses and sunscreen. If you have an air conditioner, check it to ensure it's working. Do not leave children, adults, or pet in parked cars. To stay informed and receive heat alerts from the Windsor-Essex County Health Unit, residents can subscribe to our website or follow us on social media. As the weather warms up and province continues to reopen, it is imperative that the residents continue to practice and follow public health guidance. Maintain physical distancing of 2 meters from individuals outside of your home. Limit social gathering. Wash your hands regularly and often. Avoid touching your face and stay home if you're sick. If you are sick or think you're exposed to COVID-19, visit the assessment center for testing. Thank you.
Now take questions from the media. We'll start with AM 800.
Dr. Ahmed, very nice weekend out this past couple of days. Have you noticed any issues at area parks, golf courses, on the water with boating? Have you noticed any issues, or have any been reported?
We haven't received any complaints so far, so I can't say. I was not outside, so I can't tell what was happening. But we have seen some pictures out in Toronto, which with large gathering of people. That really scares me. So I'm not sure if that is the case or it was something that happened over the weekend in our community, but we didn't receive any complaints.
Speaking of large gatherings, I know over the weekend the Harrow Fair announced that they are postponing their event. Last week, Hotel du Grace announced some of their events, including their fall gala, is canceled or postponed, till next year. A number of weddings have already been postponed, canceled, along with other events. And that's usually for the summer. Talking about the summer, what's your message to those that have events planned for the fall? Let's say September, October, November. Should they consider postponing their events?
So it would be hard to predict what future lies ahead, but I think they should definitely consider postponing if possible. Right now, the province has a restriction on large gatherings, which is very clear. We don't know how it would change. We don't know how COVID-19 will continue to behave with all these easing of restrictions. So there's a lot of unknown at this point, but until we have a stable vaccine which is effective and available for everyone, we won't be able to say with certainty what the future looks like. So I think organizers, it would be in their interest to consider alternate plans and or consider postponing the event if possible.
Thank you. Any questions from Windsorite?
I'm okay for the moment.
Any questions from Windsor Star?
Yes, Doctor. Do you know if a lot of resources had to be allocated in order to fulfill the increased testing that the province has allowed?
Most of these testings are happening with the assessment center. From our perspective, we support all the long-term care homes who need testings and swabbing support. We also are working with some other congregate settings, which requires mass testing or additional support from public health. We are also doing some of the testing at the migrant farms, depending on the risk and the context of what we are finding. So there are a lot of work that's involved. We are partnering with also Essex Windsor EMS to do some of the other mass testing. So I can speak from my organization perspective that this is what we are engaged with, but recognizing that with the Premier's announcement, there may be more traffic or more people showing up at the assessment center.
Thank you.
Any questions from CBC?
Yes, Dr. Ahmed. Consistently, the province, as well as the health unit, has been reporting numbers of cases in long-term health units, or long-term care centers and retirement homes. But why not in public industry? Today we have 33 cases in extra farm workers. Isn't it important for the public to know where those cases are as well?
Well, I think that's the request that we are getting from the media as well. But the thing is, going back to the same idea, it's what's the public health benefit of even reporting it? We can report it, and in one of the facility that had more cases, so we issued a joint media release to discuss what these cases looks like. But having one or these two individuals, these are private businesses that we are talking about, and if the risk to the community would be there, I will be the first one to report that, to disclose that, because there would be some public health action attached to it. Right now, it's we're talking about 8,000 to 10,000 of these workers in our community. We're talking about more than 170 business establishments, and we will have to take a look really from the risk to the community perspective. If the risk is there, I'll be the first one to report.
Could you explain maybe then why it is important for us to get long-term care retirement home numbers? I mean, is there a risk? What's the risk to the community there? If you could just explain it for us, please.
So these facilities are where our community members lives, and these are the facilities which is part of our responsibility and our mandate to ensure that the outbreaks and things are managed, and it's part of our disclosure that the province requires us to disclose. So all this is there to ensure that the community is aware of what the requirements is. If the province come back with a requirement to say that, yeah, you must disclose every business establishment that have a case, we will do that. But other than that, if that's not the case, we will do it based on the public health risk to the community. If there's a risk, we'll report it.
Thank you.
Any questions from Blackburn?
Yes, so you're saying that these 33 cases come from multiple facilities, and they're not just in the migrant farm residences, they're community employees as well. So are these facilities safe to work in? Would you be in a position to shut down a facility if they weren't taking the necessary precautions for their employees?
Absolutely. If there is any risk that we will feel that this facility is not doing the work that they should in terms of protecting their employees, or if the case numbers are significant enough that would warrant us to consider shutting down the facility, we will do that.
So an outbreak at a long-term care facility is considered just one staff member or resident. What's the criteria for declaring an outbreak at another place of business?
So that's a good question, and I think that's it's not defined anywhere. So what we do is when we are investigating all these cases in these facilities, we basically estimates the risk of transmission in the facility, and then the public health measure that comes in to protect individuals and employees in that facility. A lot of these restrictions and these workplaces fall under the Ministry of Labor, and they have their own requirements too. So I think it really depends on the risk from that facility for their employees, and also the risk to the community that would help us trigger an outbreak or call it an outbreak. The number of cases that we are talking about, they are not necessarily a result of transmission happening at the facility itself. A lot of these cases are happening because all these employees, they share a common living area, which could be not which most of the time do not allow proper physical distancing. So if all these individuals are there, it's very easy to have just one person who's infected, and then potentially infecting everyone else who lives in the same who live in the same house.
Any questions?
So what?
Sorry, go ahead.
Sorry, I just. So there's no, besides the release that you sent out last week, there's no one facility that you could say these cases are coming from?
Yeah, so that's just one facility which have most of the cases, and we're continuing to work with that. Over the weekend, we did some expanded testing in that facility to identify more cases and being proactive in testing majority of those employees, and we'll continue to do that. But other than that, there are these individual cases in many of these farms, and they are being monitored and managed by our staff doing the case and contact management and identifying others.
And you said there's no risk to the community, but obviously there's risk within the workplace. Are all the workplaces and all the employees notified when there is a case within their facility?
As I said, a lot of that is under the Ministry of Labor, and then they are doing the inspection as well. So every time there is one case in any of these facility or workplace, the Ministry of Labor triggers an inspection on their own. They follow up with the facility, and they ensure that the employees in that particular facility is protected. From a public health perspective, what we want to make sure is that how that risk is translated back into the community, and even if it requires more expertise from a public health perspective within that workplace, then that triggers us to get in and provide more guidance and more support to the facility.
Any questions from CTV?
You said that, one is the main culprit, I guess, in all of this. So is it in Kingsville? Is it Leamington? Can you be a little more specific that way, I guess? You know?
I'll have to get back to you on that. I don't have the specific address in my mind. I know the name, but yeah.
All right, that's okay. And just curious, too, are you, because of this, will you be visiting other agri-farm facilities to ensure that they're following proper procedures?
We just have to be careful in terms of what our role is. Inspecting these businesses is not something that's a public health requirement or a mandate. We do have a requirement for all these housing accommodations that these temporary foreign workers live in. So our public health inspectors do inspect those those houses and ensure that they're meeting the public health requirement, which doesn't necessarily mean that it's COVID specific requirement that they're required, because under the law, they just have to meet certain guidance, which they meet. From a workplace perspective, we are working with the workplace mostly on the prevention and education side of the thing, and to provide support at what they need to do. We have been in contact with almost all the facilities that have cases, and to offer our assistance and support. We review every time we are connecting with them. We review what is your process of screening your employees. What happens if someone comes back and if they are a positive case, or if they fail on one of the screenings. So if someone is coming in and based on the screening questionnaire, they're asked if you have fever or cough, then what happens? How are they transported or sent to the assessment center to get tested? And then if they're positive or if they have symptoms, where are they going? How they're self-isolating? So that part, we do get into really details of it, that how we are managing it. But what happens inside, we do get the information too, that are you maintaining physical distancing at your workplace? What does your workplace environment look like? What about the break rooms? When they're going into these break rooms, do you allow enough physical distancing there? Do you allow enough staggering of your staff time not to allow them to congregate? And if they're congregating, is it the same group that they typically work with, or anyone can come in any time? So those are the measures that we are trying to basically try to do more like of a concentric circle type approach, that if 10 or 15 of these employees are working together, then they are the one who is interacting with each other and not interacting with the rest of the group. So that's one thing. And then we also have some of these contractors coming in and providing their employees and staff support to these places. So we have to have that conversation with them too, that how they're coming, what's their process, how they're being put into work, what's the requirement. So that kind of work we do, but not necessarily going in and inspecting just like we do with the long-term care home and retirement home. We don't do that. That's, again, it's a private establishment, and the Ministry of Labor does that kind of assessment.
Okay, so is this something where you will get handled, or the problem won't be a problem like they did in the LTC?
I can't say that, because I think we do know that the living condition and the working condition, it is not as simple. It does allow people to come in contact with each other as much as they try not to, but there will be opportunities that they will come in contact with. A lot of these employers are masking their employees, so that helps a lot, but still there are other things that could come into play. And then the other part is, as I highlighted, that when these employees go back home, they share a house with many other workers, and sometimes they are the workers in the same working in the same farm, and sometimes they work in different farms. So even now you have a worker who suddenly got sick, but the living arrangement with other workers exposed someone else at another farm, and now that worker went to another farm and then potentially infecting others. So it's a very, I guess, high risk environment for sure. That's why our effort has always been and will continue to be to do more on the prevention side. And the moment we have a case, we'll immediately get on top of it and try to do aggressive case and contact management to prevent spreading it to other people.
And then one quick one, just the random testing. What day of the week is that going to be starting?
So as I said, we did had a conversation with our EMS partners, and we came up with the plan to move forward. So I think we just need to make sure that we have covered all the logistics that goes into play, and as soon as maybe middle of this week or end of this week, we will start. We want to get it done as soon as possible.
Any further questions from AM 800?
No, thank you.
Windsor-Essex?
Yes, over the last week or so, the number of cases locally and across the province have been increasing. If that trend continues, can you foresee new measures being put in place, such as the closure of businesses?
Absolutely, and I think this is something that I am particularly concerned about, and keeping a close eye on it, and that's why we are even trying to provide that kind of breakdown to see where these cases are coming from. And today, as we are reporting 36 cases, the number is pretty high. But if you really break it down, to 33 of them are in a very defined group of people, and the 3 are from the community. We'd like to see that. And again, going back to the same idea of giving the right message to the people. The message is, even when it's outside and when you're going out, COVID-19 hasn't gone away. It is still exists in our community. And if you want to keep the economy, keep the businesses open and running, we need to make sure that we are not adding to the burden of cases. If we add more cases in our community, there is a strong possibility that we may want to go back to the shutting down some of these businesses. So it is up to each one of us to do our part and try to live on in the new world where we are practicing all these physical distancing and following all these public health measures to enjoy the life as we would like to enjoy, with some restrictions. And that restriction, I don't anticipate that this will go away anytime soon. So it's better to be aware. It's better to know how you can protect yourself, instead of thinking that either you're getting a test done, or if you're visiting people, that doesn't change any risks for you. The risk will continue to exist exactly the same way, which is today and tomorrow and the day after tomorrow. So you practice your physical distancing, you wash your hands frequently and often, and you are staying home when you are sick or when you're not feeling well. So let's just be very clear, even if you're going for testing, even when you're outside, the risk exists. Please follow all those measures before we go back to the same situation when we have lots of cases, case counts increasing, and we need to have that conversation how we want to scale it back down. So it is in our best interest for all of us to follow all these guidelines.
Any questions from the Windsor Star?
Dr. Ahmed, sorry.
Go ahead.
Dr. Ahmed, you mentioned the Trinity Bellwoods Park images from Toronto over the weekend. In addition to those, over the weekend, there was Memorial Day weekend in the United States. There's other venues, recreational venues full of crowds, pool parties. How do you feel when you see these total disregard for all measures?
One word, very scared for our community. And if things like that happens, that's exactly something that can trigger a second wave that everyone is talking about. And even from the past practices, from our prehistory lesson, 1918 Spanish flu, the second wave was much bigger and much more deadlier. We definitely don't want to go there. So even when people are looking at it and they may feel that it's okay if other places are doing that, no, it's not okay. Any kind of any change in our behavior, any shift in our attitude can easily take us back to exactly where we were or even worse. So I do worry that people shouldn't take this message or take these pictures as inspiration. Instead they should be very scared to see that images and try to be mindful of what our role is and how we should play our part in reducing the chain of transmission and just while still enjoying some of the things that we like to enjoy.
Thank you. Go ahead, Taylor.
Doctor, I'm not sure if you said this, but is it the migrant farm populations being affected? Is it specifically one facility? Did you name that facility?
We did send out a media release, I believe, last week or the week before, 2 weeks ago. So that's that facility is still that we are working with that facility, and we have some cases, but mostly these are the contacts of the original cases. And as we are continuing to expand the investigation, we are finding more contacts, and that's why we expanded the testing over the weekend to many more employees of the same facility to have a better handle on who is at risk and who could potentially have the disease and try to get ahead of that.
Thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thank you.
BTV? Thank you, everyone.
Thank you.
Thank you.